Okay, so we're going to go over some general foam rolling exercises. We're going to go ahead and start off with the quadriceps. Carrie, let's go ahead and demonstrate the quadriceps, doing both quadriceps at the same time. So go ahead and lie over the foam roller. You can either start in the upper quad or the lower quad. I usually divide, because it's such a long muscle group, I usually divide it into two. And roll out one side and then, roll out one half and then the other half. For the male population, you're going to have to obviously be very cognizant of where you're at when you're higher up into the quad. If you'd like a little bit more of a intensity, you can always stack one leg on top of the other. So that's actually a technique that you can do everywhere in a leg, including the hamstring and the calf. So the question comes up often with foam rolling: how often or how long should I be doing it? Definitely do it before every workout. Do it as long as you need to, though, is usually my general answer. Usually about 1 minute to 2 minutes in any particular area is good. If you find a tight spot, I'd go there a little bit longer. Okay, Carrie, go ahead and sit down on the foam roller for us. So what Carrie's going to do now is roll out her glutes. Now we can do the glutes a couple different ways. We can roll the glutes out like she is now, both at the same time. We can cross one foot over the other. Good. And then we can kind of hone in a little bit. The other variant is to cross that foot over that opposite knee. There we go. Yep. And then lean over to the side. With all of these, including even starting with the quad, with all of these, keeping the spine in neutral is top priority. Good. Carrie, go ahead and relax. You'll also notice, too, when you're doing the foam roller that, Carrie, if you go ahead and put your hands behind the foam roller, there you go. Yep. You're going to be able to roll higher up the glutes into the glute med area when you utilize this position. So from here, usually the easiest thing to do is, Carrie, if you just walk back with your hands and go ahead and get into your hamstrings. Again, with the legs, because the legs have long muscles, the hamstrings in the back, the quads in the front, I usually divide up the area into two spots. Hit the high part first and then the low part. Like the quads, and like I stated earlier, if you want a little bit of added intensity, you can always cross your leg. Good. Now down into the calves, same rules apply. Good. And for those patients, for those athletes that have shin splints, you can do the reverse side where she's at and hit your tibialis anterior and your anterior leg group. For the sake of this video, we're just going to stick with what we've hit. Okay, go ahead and relax, Carrie. Good. Carrie, let's go ahead and show everyone's favorite, the IT band, iliotibial tract, the lateral vastus lateralis. Usually a pretty sensitive area for anyone to foam roll. Good. And again, Carrie, keep that spine in neutral. Drop the head down just a hair. There we go. So for this area of anatomy is particularly sensitive. Carrie is fairly advanced at this. The easier way to do this is to drop that right foot onto the floor in front of her. Bend your knee, Carrie, and put that right foot onto the floor. There we go. And that will take off some of the weight of the IT band. Now, an important area to hit when you're on the lateral side of the leg, right past the greater trochanter, that's the hip bone. And before you hit the iliac crest, or the top of your waist, there's a patch of muscle, very important. I'm actually going to point that out. So here's her greater trochanter, here's her iliac crest. This area right here, super important. We've got quite a few structures in there that need to be released, often on a normal basis. We've got our glute medius, very important hip extender and abductor. We also have the TFL, very important hip abductor and even flexor to some degree. So that area of anatomy needs some attention, especially if you've had any hip issues. Okay, good job, Carrie. Go ahead and sit up, and why don't you sit back onto the foam roller and let's demonstrate the back movements. Good. And she's going to go ahead and roll out into her low back. Now, when you're rolling out your low back, it's very important. You'll see that she's making a C, almost like she's doing a crunch. She's doing is she's contracting her core. She's doing that to protect her organ. She's doing that to protect the soft tissue in the area that she's at, because unlike the thoracic rib cage, there's no bony structure to protect you. So you've got to protect that area with muscular contraction. As you roll up into the thoracic spine, it's always advantageous to bring the arms up over the body. That way you have more weight where you're rolling. And in the thoracic spine, most patients, most athletes, most population in general lacks thoracic extension. So one way that we can work on that ourselves is to bring our arms up over our head as we get into the upper thoracics and really try to stretch and or melt over that foam roller. Relax the neck, let the head drop. Ladies, if you have long hair, please have it tied up. You will get it caught. I have seen it many times. It is not pretty. Try to relax those arms, let those arms drape over the side, and really let that thoracic spine go into extension. Okay, good job, Carrie, and come up. Let's go ahead and show the latissimus dorsi. This area, very sensitive for most people, more specifically anyway, very sensitive for women. Good. Yep, you can do whatever feels most comfortable. That top leg can be behind or it can be in front of the body. To get the best, as Carrie is demonstrating, her hand, her thumb is pointing backwards, her palm is facing up, that arm is stretched out straight over what would be over her head, and her neck and spine is in neutral. Carrie, you can go ahead and take a break for a second. Thank you. That area of anatomy is very important, very sensitive. Most women notice that it's very tender in that area. My argument or my theory is that those tissues are congested from lack of blood flow due to restrictive clothing and or undergarments. Within that area too, you have your serratus anterior, which is a muscle that is often injured and or ischemic or tight. So for the foam roller, that is our basic protocol. If you're watching this video, that means you're a new patient or new athlete of mine. I will test you, I will see you, there will be a written examination, so you better do it. Thanks a lot.